Hello, everyone. I'm Lana. Thank you so much for joining me. The CDC is predicting a fall in U.S. coronavirus deaths over the next 4 weeks. The death toll in the U.S. has surpassed 579,000. The nation is averaging 48,000 new cases per day, and the latest models are predicting a significant decline in infections in the coming months. But experts say we are not out of the woods just yet. The pace of vaccinations is slowing across the country. And as Mola Lengi reports, the head of the CDC says variants are still an active threat.
Tonight, there is new hope in the battle to beat COVID. The CDC is projecting the number of new cases could fall sharply by summer. But it comes with a warning. Any drop could be delayed by a continued decline in vaccinations.
Although we are seeing progress in terms of decreased cases, hospitalizations, and deaths, variants are a wild card that could reverse this progress we have made.
This comes as Moderna late today announced that early results from an ongoing clinical trial indicate a booster shot should be protective against variants first identified in South Africa and Brazil when taken in addition to its 2-shot regimen. In California, where more than 30,000 people have been vaccinated, cases are the lowest they've been since April of last year. But declining vaccination rates are threatening the new White House goal of 70% of adults getting at least 1 shot by July. In response, the government is shifting focus from mass vaccination sites to a more targeted approach.
Something I'm often asked is, when will this pandemic be over and when can we go back to normal? The reality is it all depends on the actions we take now.
Today, CVS announced it will join at least 3 other national pharmacy chains offering walk-in vaccination appointments, one step in an effort to improve vaccine access.
Get your vaccine today!
Another is to bring the vaccine directly to people in so-called pharmacy deserts.
I was waiting for it to be convenient for me.
Like south of LA. This map shows a dense population but no vaccination sites within a mile. So, community leaders parked a pop-up vaccination clinic to help get shots in arms.
We have to come to the community. We can't wait till the community to come to us.
Well, here at Citi Field, they've already vaccinated more than 100,000 people. But to encourage even more vaccinations, today Governor Andrew Cuomo announced that fans will be able to get a shot at the gate on game days and earn a free ticket to a future game. Also, beginning tomorrow, you can buy a ticket to a Broadway show as theaters in New York City are set to reopen on September 14th. Lana?
Mola, thank you. India's coronavirus outbreak shows no signs of relenting. The World Health Organization says India accounted for nearly half of all new global cases last week. Chris Livesay reports from New Delhi.
The funeral pyres now burn 24/7, not in a proper crematorium. There's no more room, but in the parking lot. With COVID claiming victims at record speed, the pandemic's global epicenter is ablaze in such misery. Dipender Singh lays his mother to rest.
Can you think of one word that encapsulates how you feel right now?
Blank. I'm blank right now. I don't have anything left right now in me.
Perhaps nowhere else is India's COVID catastrophe more visible and more palpable than here, with 120 people dying every hour across the country. The stench of death is enough to make you choke.
This in a country already gasping for breath, with oxygen in short supply. Despite the U.S. and other countries sending aid, Indians remain desperate for signs of improvement. This man says he's been waiting in line for oxygen for 9 hours. Overnight, India's death toll rose by a record 3,780 as the country posted its 14th straight day of more than 300,000 new cases. Yet experts worry the real numbers could be as much as 5, even 10 times higher.
And just today, India's Supreme Court ordered the government to come up with a plan in the next 24 hours to meet New Delhi's oxygen needs as the contagion and the carnage show no sign of slowing. Lana?
Wow, Chris, thank you. For more now, I want to bring in Dr. Len Horovitz. He is a pulmonary specialist at Lenox Hill Hospital in New York City. Dr. Horovitz, thank you for being here and for all that you do. So let's get right into the latest predictions from the CDC. They say that deaths will likely decrease over the next 4 weeks. That's great news. The head of the agency also says that models show a sharp drop in new infections by July. Can we think now that we are nearing the end of this?
We can see in state after state that as vaccination rates are increased, hospitalization and death are decreased. Connecticut, for instance, today just announced that it had fully vaccinated more than half of the population, and their vaccination rate shows that hospitalizations and deaths have plummeted in that state by 38% in the last 2 weeks. So yes, vaccination is the key to getting out of this. That said, we're probably not going to eradicate this virus the way we eradicated smallpox. That took 2 centuries of inoculation, but we did eradicate that. This virus is probably going to be transitioned to a more manageable kind of virus, like measles, which is still with us, but with vaccination, there are just little pockets of measles outbreaks here and there, but it's still with us.
You say that vaccinations are essential to really eradicating the disease, or at least being able to live with it, as you explained, kind of like measles. But new CDC data show that the pace of coronavirus vaccinations has slowed by about 20% since just last week. How concerned are you by this pretty steep drop-off?
I am concerned about this because, of course, if we want to reach that elusive goal of herd immunity, we have to vaccinate many more people. We have to get probably more than 70% or 80% vaccinated. We're finding that there's a disparity in people who want vaccines. And of course, we're identifying those people. Men more than women don't seem to be inclined to get the vaccine. As with everything else in this pandemic, it's been politicized, and Republicans more than Democrats are not likely to want to be vaccinated at this point. So we need incentives to get people to want to be vaccinated, trusted figures, monetary incentives, tickets to Broadway shows, that sort of thing, to also let people see over time that as people are vaccinated, they're not dying. And in fact, the effect is good. Hospitalizations are down, deaths are down. The side effects of the vaccine are mild, and that people are living and going back to normal life because of that. Hopefully that will be convincing more people over the next few weeks.
You know, it's interesting because I have seen promotions at certain vaccination sites where no reservation is required and you get a vaccination and then you can get a free drink or the like. I want to talk to you, too, about not only these incentives, but federal agencies are joining forces to try and boost access to coronavirus vaccines in some of the hardest hit communities. When it comes to these communities, is it more a question of access, or does more in terms of incentives or other things need to be done in order to get people vaccinated?
Particularly in rural communities, the access problem is really distance and sometimes transportation, which is why mobile units going out to these communities is a better idea than expecting them to show up at some metro area that's too distant from where they live. So we have to make more of an outreach into rural areas and to pockets of places in the United States where they might not be exactly 5 miles from a pharmacy or a vaccination site. And so I think that will be the strategy going forward, is to send out more smaller units, armed forces, with vaccinations and vaccinate people in rural areas.
Well, you know that I have asked ad nauseum about the question of kids, and the White House is making plans to get adolescents vaccinated pending authorization of the Pfizer vaccine by the FDA. I'm wondering, do you foresee any major obstacles in vaccinating younger Americans, and how young are we talking here?
Right now, we're looking at 12 to 15-year-olds, and hopefully that vaccination effort will start next week. If the FDA approves that, then we have to look at ages 2 to 11, and that will be the next group of children that hopefully will be vaccinated. Then hopefully as young as 2 months can be vaccinated. The fact is that children seem to tolerate the vaccines extremely well, have a very robust immune response to it. We also have to keep in mind that last year at this time, only 3% of cases were in children. Now it's 23% of cases in children. And so it's important to understand that children are a reservoir of COVID-19, and we really need to vaccinate them in order to reach herd immunity.
One last question for you, Dr. Horovitz. Dr. Fauci told The Hill that he believes wealthier countries have a, quote, moral obligation to help the rest of the world with their vaccination programs. How important is this, and which countries need the most help?
It's not just a moral obligation, it's a medical obligation, because in a global pandemic, it will never be brought under control unless every country can bring its citizens under control with vaccination. We're having a particularly difficult time now, a catastrophe in India, in South America. And so if the virus is allowed to rage on in those countries, more variants can develop. And of course, those variants will find their way back into the United States. It's a global pandemic, and it has to be a global strategy to vaccinate the world.
All right, Dr. Len Horovitz, always appreciate you coming on the show.
Thank you.